death and dying has become a taboo subject. It's long been a taboo subject in Western societies. And yet I think there's increasing evidence that actually we're capturing experiences of death and dying visually in various different ways. The trouble is, with the growth of new technology, it's offering more opportunities to do that, but there are differences in understanding about the acceptability of that across generations, and also about whether that's beneficial or not, the therapeutic potential of understanding death and dying visually. Probably the best way to explain that is to give you an example. Within families, we carry on taking photographs of people when they're dying. Some families might not, but there's a question mark about whether we carry on taking photographs. How we dress people, do we dress up? If we're the person who's dying, you know, how do we present ourselves in front of the camera, and how do we use those images? Images of the family remain important, and they're a way of constituting the family. You know, we position the family photograph on the mantelpiece, and to exclude somebody has quite a big impact. So I want to raise questions about practices when somebody's dying within the family, the use of photographs there. Another example, there's a doctor who wrote a letter to the British Medical Journal saying he'd spotted a relative taking a photograph of a dead body shortly after somebody had died, when the body still had tubes in, and, you know, a lot of interventions to try and keep this person alive, and they thought it was a little odd. And I don't think there's any kind of ethical guidelines or procedures about the taking of images in that context. But I think increasingly technology, we expect to keep visual records of our daily lives, and we haven't got any guidance about that. You know, some people find it acceptable, other generations don't. Should we allow that in a hospital setting, or shouldn't we? What happens to those photos? To what degree now can we make those photographs public instantly, and yet we don't control over who has news of a death or who might see these images? And like I say, you know, they might be therapeutic to some people and disturbing to others. So there's a whole heap of questions about the taking of images. But I think also it can extend our understanding of dying, because we tend to think of it as something that older people do, and yet that can take place over the life course. Think about the use of images in neonatal contexts when a baby's just died, and actually the expectation is that photographs will be taken to give that child a history, a story, because they otherwise don't have a biography. So I think it's a fascinating field, and I'm hoping to bring together a number of academics to explore that.